Good morning. I'm Michael Cook, Chief of the Census Bureau's Public Information Office. I'd like to welcome everyone following this broadcast on census.gov or listening in on the phone. Today we're releasing our national estimates of income, poverty, and health insurance coverage for the annual social and economic supplement of the current population survey pertaining to the 2015 calendar year, as well as health insurance coverage trends and state-level statistics for the American Community Survey. Additionally, we are releasing 2015 findings for the Supplemental Poverty Measure. Here's our program for today's news conference. First, we are pleased to have David Waddington, the Chief of our Social, Economic, and Housing Statistics Division, to discuss the findings. As always, during our news conferences, once the presentation concludes, we will open the phone line to questions from reporters and members of the media. Let me point out that on our homepage, census.gov, we will momentarily post a variety of resources to assist you in completing your stories. Click on the slide at the top of the page, and you will be sent to an electronic press kit containing today's webinar slides, the news release, and links to detailed tables, the full reports, blog posts, and fact sheets about today's release. So, without further delay, let me present Mr. David Waddington.
Thank you, Michael. Good morning, and thank you for joining us. Today, we are releasing national income, poverty, and health insurance coverage estimates. Let me begin by summarizing the main findings. Median household income for the nation was $56,500 in 2015, an increase in real terms of 5.2% from the 2014 median of $53,700. The official poverty rate in 2015 was 13.5%, down 1.2 percentage points from 2014. In 2015, there were 43.1 million people in poverty, 3.5 million less than in 2014. The Supplemental Poverty Measure, or SPM rate, for 2015 was 14.3%, a 1 percentage point lower than the SPM rate for 2014. The percentage of people without health insurance coverage for the entire calendar year was 9.1%, or 29 million people. This was a decrease of 1.3 percentage points from the previous year. We are releasing 3 reports today: income and poverty in the United States for 2015, health insurance coverage in the United States 2015, and the Supplemental Poverty Measure 2015. This is the second time we have released the SPM estimates at the same time as the official poverty estimates. The Income and Poverty Report and the SPM report are based on data from the Current Population Survey's Annual Social and Economic Supplement. The Current Population Survey is the longest-running survey conducted by the Census Bureau and is the official source of the national poverty estimates. The estimates are calculated in accordance with the Office of Management and Budget Statistical Policy Directive 14. The Health Insurance Report includes data from the Current Population Survey and the American Community Survey. The American Community Survey is an ongoing survey that has a much larger sample size than the Current Population Survey, making it the recommended source of health insurance statistics for smaller populations and levels of geography. Let me start by giving more details about the changes we observed in income. This chart shows the median household income from 1967 to 2015 in real inflation-adjusted dollars. Recessions, as defined by the National Bureau of Economic Research, are depicted in this and all time series charts in light blue shading. The median represents the point on the distribution of household income at which half the households have income above it and half have income below it. Real median household income was $56,500 in 2015, an increase in real terms of 5.2% from the 2014 median of $53,700. This is the first annual increase in median household income since 2007. Looking at selected demographic characteristics, this next chart shows household income by age of householder for 2014 and 2015. Notice the pattern, with the householders aged 15 to 24 having the lowest median income and householders aged 45 to 54 having the highest median income. All householders aged 25 and over had a real median income increases between 2014 and 2015. Next, we show household income by race and Hispanic origin. The real median income of non-Hispanic white, Black, and Hispanic origin households increased 4.4%, 4.1%, and 6.1% respectively between 2014 and 2015. Among the race groups, Asian households had the highest median household income in 2015, though the 2014 to 2015 percentage change in their real median income was not statistically significant. Non-Hispanic white households and Black households last experienced an annual increase in median income in 2007. Asian households last experienced an increase in 1999. For Hispanic households, the most recent annual increase was in 2013. This next chart shows household income by nativity of the householder for 2014 and 2015. Real median household income between 2014 and 2015 of households with a foreign-born householder increased 5.3%. The median income of households with a native-born householder increased 4.4%, and the median income of households with a non-citizen householder increased 10.5%. The median income of households with a naturalized citizen householder was not statistically different from the 2014 median. In 2015, the households with a naturalized citizen householder had the highest median household income, followed by households with a native-born householder. Households with a non-citizen householder had the lowest median household income at $45,100. While the median represents 1 point in the distribution of household income, other points provide additional information about the nation's household income distribution. For example, 10% of households had income below $13,300. 10% of households had incomes above $162,200. And 5% had incomes above $214,500. Changes in the relationship of these income measures and the shares of income they possess can indicate how income inequality is changing. Using the information about the distribution of household income from the current population survey, we can produce a Gini index, a widely used measure of income inequality. The Gini index indicates higher inequality as the index approaches 1. The Money Income Gini Index is calculated using pre-tax cash income and was 0.479 in 2015. It was not statistically different from 2014. Based on the equivalence adjusted income, which adjusts for family size and economies of scales, the Gini Index was 0.462 in 2015, also not statistically different from 2014. These next slides switch to earnings and work experience data for people aged 15 and older. Here we see historical data for real median earnings and female to male earnings ratios for full-time year-round workers from 1960 to 2015. The median earnings of men and women who worked full-time year-round increased 1.5% and 2.7% respectively between 2014 and 2015. This is the first significant annual increase in median earnings for men or women since 2009. The female to male earnings ratio was 80% in 2015, not statistically different from 2014. Over the long term, this ratio is up from 61% in 1960. This slide shows the number of workers historically by work experience and sex. Between 2014 and 2015, the total number of people with earnings, regardless of work experience, increased by about 3.3 million. The number of men and women full-time year-round workers increased by 1.4 million and 1 million respectively between 2014 and 2015. Now we'll take a look at poverty. This slide shows the official poverty rate and the number of people in poverty. The official poverty rate in 2015 was 13.5%, down from 14.8% in 2014. In 2015, there were 43.1 million people in poverty, down from 46.7 million in 2014. In 2015, a family with 2 adults and 2 children was categorized as in poverty if its income was less than $24,036. Here we demonstrate the difference in poverty trends across race and Hispanic origin groups. For non-Hispanic whites, the poverty rate decreased to 9.1 percentage points in 2015, down from 10.1% in 2014. The poverty rate for blacks decreased to 24.1% in 2015, down from 26.2% in 2014. For Hispanics, the poverty rate decreased to 21.4% in 2015, down from 23.6% in 2014. Asians, with a poverty rate of 11.4% in 2015, were the only major racial group to show no change in their poverty rate from 2014. This slide looks at poverty rates by age. In 2015, poverty rates declined for all 3 major age groups. For children under age 18, 19.7% were in poverty in 2015, down from 21.1% in 2014. Poverty in 2015 decreased for people aged 18 to 64 to 12.4%, down from 13.5%. For people aged 65 and older, the 2015 poverty rate declined to 8.8% in 2015 from 10% in 2014. The poverty rate for all females was higher than the poverty rate for all males, but age matters. Gender differences in poverty rates were more pronounced for people aged 18 to 24 and people aged 25 to 34. The poverty rate for women aged 25 to 34 was 16%, while the poverty rate for men aged 25 to 34 was 9.9%, a 6.1 percentage point difference. The poverty rate for women aged 18 to 24 was 5.3 percentage points higher than the poverty rate for men in this same age group. On the other hand, for children under age 18, the poverty rate for girls was not statistically different than the poverty rate for boys. The estimates in the Income and Poverty Report are based solely on money income before taxes and use the poverty thresholds developed 50 years ago. In 2009, the Office of Management and Budget's chief statistician formed an interagency technical working group. This group provided the Census Bureau and the Bureau of Labor Statistics a set of observations to serve as a roadmap in the development of the Supplemental Poverty Measure, or SPM. The SPM will not replace the official poverty measure and will not be used to determine eligibility for government programs. The SPM uses thresholds produced by the Bureau of Labor Statistics from the Consumer Expenditure Survey data, with separate thresholds for renters, homeowners with a mortgage, and those who own their homes free and clear. The thresholds are adjusted for geographic differences in housing costs. The resource measure begins with the pre-tax cash income, but adds estimates of the value of tax credits and housing, energy, and nutritional assistance. It further subtracts estimates of payroll taxes, income taxes, child support paid, child care paid, other work expenses, and contributions toward the cost of medical care and health insurance premiums. For the second time, we are releasing the SPM estimates on the same day as the official poverty estimates. This slide compares the SPM estimates for 2015 with the SPM estimates for 2014 for all people and by age group. The 2015 SPM rate for the entire population was 14.3%, 1 percentage point lower than the SPM rate for 2014. There were statistically significant decreases in the poverty rates for people aged 18 to 64 and for those aged 65 and older between 2014 and 2015. The SPM rate for children in 2015 was 16.1%, not statistically different than the rate for 2014. The SPM rate for adults aged 18 to 64 fell from 15% in 2014 to 13.8% in 2015. The SPM rate for those aged 65 and older fell from 14.4% to 13.7%. This slide compares the SPM estimates for 2015 with the official poverty estimates for people of all ages and by age group. The 2015 SPM rate for the entire population was 14.3%, 0.7 percentage points higher than the 2015 official poverty rate. Looking at the specific age categories, the SPM rate was lower than the official poverty rate for children, but higher than the official poverty rate for people aged 18 to 64 and people aged 65 and older. One important contribution that the SPM provides is allowing us to gauge the effectiveness of tax credits and transfers in alleviating poverty. We can also examine the effects of the non-discretionary expenses such as work expenses and medical out-of-pocket spending. This graph shows the impact on the 2015 SPM rate of the addition or subtraction of a single resource element. Some of these elements, such as Social Security and unemployment insurance, are included in the money income measure used in the official poverty estimates. Other elements, such as Supplemental Nutrition Assistance Program or SNAP benefits and refundable tax credits, are included only in the SPM resource measure. Using this chart, we can see that 26.6 million people were taken out of poverty by Social Security benefits. 9.2 million people were taken out of poverty by refundable tax credits. And 4.6 million people were taken out of poverty by SNAP benefits or food stamps. However, by subtracting medical out-of-pocket expenses from income, increased the number of people in poverty by 11.2 million people using the SPM. Now I'd like to turn to health insurance. Over time, changes in the rate of health insurance coverage and the distribution of coverage types may reflect economic trends, shifts in the demographic composition of the population, and policy changes that impact access to care. Several such policy changes occurred in 2014 when many provisions of the Patient Protection and Affordable Care Act went into effect. In 2015, most people, 90.9%, had health insurance coverage at some point during the calendar year, with more people having private insurance at 67.2% than government coverage at 37.1%. Of the subtypes of health insurance, employment-based insurance covered the most people, followed by Medicaid, Medicare, direct purchase, which includes health insurance exchanges, and military health care. The percentage of people covered by any type of health insurance increased by 1.3 percentage points to 90.9% in 2015. Increases in both private health insurance coverage and government coverage contributed to the overall increase in coverage between 2014 and 2015. The rate of private coverage increased by 1.2 percentage points to 67.2% in 2015. The government coverage rate increased by 0.6 percentage points to 37.1%, while the overall rate of both private and government health insurance increased. Coverage rates have not changed for every subtype of health insurance. Between 2014 and 2015, coverage rates increased for two types of coverage: direct purchase health insurance and Medicare. The largest percentage point change in coverage was for direct purchase, which increased by 1.7 percentage points. The Medicare coverage rate increased by 0.3 percentage points for the population as a whole. However, this increase was due to an increase in the number of people aged 65 and over, and not to changes in Medicare coverage rates within a particular age group. Coverage rates did not change for the other types of health insurance between 2014 and 2015. Here on the right, we see the change in health insurance coverage rates since 2013, the baseline year before many provisions of the Affordable Care Act went into effect. The uninsured rate decreased by 4.3 percentage points between 2013 and 2015. The percentage of people covered by private health insurance increased by 3 percentage points in this 2-year period. However, between the two subtypes of private coverage, only direct purchase health insurance had a significant change. During this time period, the percentage of people with government coverage increased by 2.6 percentage points. Among the subtypes of government coverage, Medicare coverage rates increased by 0.6 percentage points, and the Medicaid coverage rate increased by 2 percentage points. As I mentioned earlier, the American Community Survey has a much larger sample size than the current population survey, making it a useful source for estimating and identifying changes in smaller populations. This figure shows the uninsured rate by single year of age for 2013 in light blue, for 2014 in medium blue, and for 2015 in dark blue. According to the American Community Survey, the uninsured rate at the time of interview dropped for every single age under 65 between 2014 and 2015. This is the second year of declines across all these ages. Younger adults tend to experience a larger drop than older adults. For example, the uninsured rate declined by 5.6 percentage points for 26-year-olds and 1.9 percentage points for 64-year-olds. Adults aged 26 continued to have the highest uninsured rate at 19.5% in 2015. 3 notable sharp differences remained in 2015 between single age years. Specifically, the uninsured rate was about 1.5 times greater for 19-year-olds compared with 18-year-olds, almost 1.25 times greater for 26-year-olds compared with 25-year-olds, and the uninsured rate for 65-year-olds was about 1/4 of the rate of 64-year-olds. Between 2014 and 2015, the uninsured rate decreased for each income category, but more for the population in lower income than for the population with higher income. In 2015, people with lower household income had higher uninsured rates than people with higher income. The uninsured rate for people in households with an annual household income of less than $25,000 was 14.8%. This compares to 4.5% for people in households with incomes of $100,000 or more. Between 2014 and 2015, uninsured rates decreased for all work experience groups. The largest decrease, 2.3 percentage points, was for the working population who worked less than full-time year-round. The percentage point decrease for the population who worked full-time year-round was smaller at 1.3 percentage points. In 2015, the uninsured rate for full-time year-round workers was 9.9%. For people who worked less than full-time year-round and for non-workers, the uninsured rates were higher, both at 15.8%. Between 2014 and 2015, the uninsured rate decreased for most race and Hispanic origin groups. The decrease was greatest for Hispanics at 3.6 percentage points. The decrease for non-Hispanic whites was 0.9 percentage points, and the decrease for Asians was 1.9 percentage points. The current population survey did not measure a statistically significant difference in the health insurance coverage rates for blacks between 2014 and 2015. In 2015, the non-Hispanic whites had a lower uninsured rate at 6.7% compared with other groups. The uninsured rate was 11.1% for blacks and 7.5% for Asians. Hispanics had the highest uninsured rate at 16.2%. The American Community Survey is also a useful tool for estimating and identifying changes in the uninsured population at the state level. On this map, each state is colored in a shade of blue, with the darkest blue representing uninsured rates of 14% or more. Lighter shades represent fewer uninsured, and the lightest blue category represents an uninsured rate of less than 8%. Here, beginning in 2013, The year before many provisions of the Affordable Care Act went into effect, most states are in the darkest category. Only 3 states and the District of Columbia were in the lightest category. Here is the map for 2014, the year many provisions of the health care law went into effect. In general, the colors on the map are lighter now, as 11 states and the District of Columbia are in the lowest category. Here is the map for 2015. Between 2014 and 2015, 47 states and the District of Columbia showed a decrease in the rates of people without health insurance coverage at the time of interview. 21 states and the District of Columbia have uninsured rates of less than 8%, and just 2 states, Alaska and Texas, had uninsured rate of 14% or more. During 2015, the state with the lowest percentage of people without health insurance at the time of interview was Massachusetts at 2.8%, while the highest uninsured rate was for Texas at 17.1%. Variations in the uninsured rate by state may be related to whether the state expanded Medicaid eligibility beginning in 2014 as a part of the Affordable Care Act. The 2 maps shown here highlight whether or not states expanded Medicaid eligibility. The map on the left shows states that expanded Medicaid eligibility, which we refer to as expansion states. They are highlighted in blue on the left map. The map on the right shows in blue states that did not expand Medicaid eligibility, referred to as non-expansion states. In general, the uninsured rate in expansion states was lower than in non-expansion states. In expansion states, the uninsured rate in 2015 was 7.2% compared with 12.3% in non-expansion states. Looking more closely at these 2 groups, this figure shows the decrease in uninsured rates for expansion states. The light green dots furthest to the right are the uninsured rates in 2013. Moving leftward, the 2014 uninsured rates are in medium green, and the dark green represents the 2015 estimates. The overall decrease in expansion states between 2014 and 2015 was 2.4 percentage points. The decrease for individual states ranged from 0.5 percentage points to 3.9 percentage points. The uninsured rates for expansion states in 2015 ranged from 2.8% in Massachusetts to 12.3% in Nevada. This is the same graph, but now for non-expansion states. The overall decrease between 2014 and 2015 was 2.1 percentage points in non-expansion states. The decrease for individual states ranged from 1.1 percentage points to 3.2 percentage points. The uninsured rates for non-expansion states for 2015 ranged from 5.7% in Wisconsin to 17.1% in Texas. People and families are classified as being in poverty if their income is less than their poverty threshold. Medicaid eligibility is often related to the income to poverty ratio. While the uninsured rates decreased at each level of poverty between 2014 and 2015, the overall decrease in the uninsured rate was greater in expansion states than in non-expansion states for people living below 100% of poverty and between 100 and 399% of poverty. In both expansion states and non-expansion states, the working age adults with higher income to poverty ratios had lower uninsured rates. However, in 2013 through 2015, the uninsured rate was higher in non-expansion states than in expansion states at all levels of poverty. That concludes my part of the presentation. Here again are the highlights. Median household income for the nation was $56,500 in 2015, an increase in real terms of 5.2% from the 2004 median of $53,700. The official poverty rate in 2015 was 13.5%, down 1.2 percentage points from 2014. In 2015, there was 43.1 million people in poverty, 3.5 million less than in 2014. The supplemental poverty measure in 2015 was 14.3%, 1 percentage point lower than the SPM estimate for 2014. The percentage of people without health insurance coverage for the entire calendar year was 9.1%, or 29 million people. This was a decrease of 1.3 percentage points from the previous year. Thank you, and now I'll turn it back over to Michael.
Thank you, David. Now we'll take a brief break as we prepare for a question and answer session for media. If a member of the media would like to ask a question, please dial 877-917-4904 and enter passcode 4044808 when prompted. We'll be right back, everybody. Welcome back, everyone. Now we will open up the discussion to questions. We ask that you state your name and media affiliation when you ask a question. We want to give everyone an opportunity to ask a question. We allow one question and one follow-up question. Joining us for the question and answer session, in addition to David Waddington, are his counterparts from our Social, Economic, and Housing Statistics Division. Jennifer Cheeseman-Day, Assistant Division Chief for Employment Characteristics, and Trudy Renwick, Assistant Division Chief for Economic Characteristics. Following the news conference, our staff can arrange for interviews for any additional questions. You may obtain further information by calling 301-763-3030 at the conclusion of today's news conference. We will now open the line for questions. Operator, do we have any questions?
Yes, we do, sir. Our first question comes from Tammy Luby with CNN Money. Your line is open.
Hi. A question and one request. In the future, because it's very hard to deal with getting the data all at once at the same time as listening to the call, is there any chance of getting it
while we're waiting
a little bit in advance? Second question, question is, can you hear me?
Yes, we can hear you now, operator.
Yeah, okay, great. Sorry, I had said, is there any way in the future, because it's very hard to listen to the call and write the story and update the numbers all at once, if there's any way to get the numbers in advance of the call would be great next year. Second, because I wasn't able to fully listen to the call, were there main reasons why the median income went up 5.2%? And also, I'm sure it's just a rounding issue, but if you can explain, since the last year's poverty number was 14.8 and this year's 13.5, but you're calling it a 1.2 percentage point drop, can you just explain that?
And before we answer that question, caller, we did not hear your affiliation. Could you
I'm
state your name and your affiliation,
it's
please?
Tammy Luby with CNN Money.
Thank you, Tammy. We'll address your questions now.
Okay, well, I'll start with the last question. Yes, the poverty rate went from 14.8 to 13.5. The 1.2 percentage point change is when you do the subtraction with unrounded numbers. And you can see it in a footnote in our report. We'll give you the unrounded numbers where the calculation comes out to 1.2 percentage points. As for the reasons for the increase in median income, there's lots of tables that can parse this for you on our website and in the report, but probably the most important thing would be the increase in employment, and particularly increase in full-time year-round workers.
Okay. And could you just give me those numbers quickly?
I can.
The increase in the number of workers was about 3.3 million. And for men and women, I think it was about 1.4 million for men and 1 million for women.
Okay. Is that also the reason why poverty dropped?
Well, I mean, we don't get into exactly why poverty goes up or why poverty goes down, but certainly all the numbers this year are very consistent, with income being up, employment being up, and poverty being down.
Okay. Thank you very much.
And Tammy, before we run to our next caller, just wanted to let you know that the reason why this release is not embargoed is because it is our official count of poverty.
Yeah.
And so traditionally every year it comes out when it is released.
Okay, but is it at all possible then to even schedule the call for 15 minutes after the release is out, so at least the media can get the numbers and digest the report for a second and then listen to the call? Because the problem is we're just trying to do everything at once. You understand? And
I definitely appreciate that and share and understand your concerns, but unfortunately this is the standard protocol for releasing this data. But thanks for that question.
All right.
Okay.
Thank you very much.
You're very welcome. Operator.
Our next question comes from Chris Rugaber with the Associated Press. Your line is open.
Hi, Chris.
Hi. I guess you guys are having us repeat our affiliations. Chris Rugaber at AP. Thanks. And I have part of my question was answered. So I have one detail, which is you guys are all saying first gain in median income in 8 years. Looking at the table A1, it seems to be smaller increases in 2013, 2014. I assume this is a question of statistical significance, but wanted to clarify that. And then beyond that, I know you've addressed a little bit of income inequality earlier in the presentation, but like Tammy mentioned, I was doing a couple things. Can you, over the past 2 years, it seems we're seeing some declines in income inequality. Any color you can add to that would be great. Thank you.
Okay, so yes, you're absolutely correct. The nominal income has gone up in the previous years, but these increases were not statistically significant. This is the first year with a statistically significant increase in household median income year to year since 2007. So you were right about that. As for income inequality, the major indicator that we put out, the Gini index, was 0.479, which was not statistically different from the previous year. You can see in the chart in the presentation, and also there's a chart in our report, that it's up since 1967. But year to year, it's pretty hard to get a statistically significant change in those income inequality measures.
Thanks for that question, Chris. Operator, do we have our next caller?
Yes, sir. Our next question comes from Susan Milligan with U.S. News and World Report. Your line is open.
Hi, Susan.
Hi, thank you. Also, since I'm middle-aged, I can't separate out people's voices necessarily talking. So please identify yourself again before you answer, so I don't mix it up. But I was wondering that one of the things that added to the poverty level, or to people who would be in the poverty under that one metric, was medical costs. And is that a function of people not being insured and having to pay things out of pocket, or is that an increase in health insurance premiums?
Okay, this is Trudy Renwick, and in the supplemental poverty measure, we subtract from your income necessary expenses before we determine your poverty status. And one of those necessary expenses would be medical out-of-pocket expenses, which include both premium payments and other medical out-of-pocket expenses. So the numbers that we show in our report show the impact of those on the SPM rate, which I believe is 3.5 percentage points higher after we subtract the medical out-of-pocket expenses. But it's a combination of both premiums and out-of-pocket expenses.
Okay, thank you.
Thank you for that question. And operator, do we have another caller?
Yes, our next question comes from Amy Peakey with CBS Money Watch. Your line is open.
Hi, Amy.
Hi. Yes, Amy Peakey at CBS Money Watch. Thanks for taking my call. I just wondered if you could, I'm looking at slide 22, the change in number of people in poverty after including each element, and I know you just talked about medical expenses, but that was what kind of grabbed my attention, and I wondered, can you just explain that a little bit more? Does that just show the number of people who slid into poverty last year because of medical expenses, or is this over a period of time? And how does that compare? Do you have any details about how that compares with previous years? How many people were in poverty because of medical expenses 10 years ago or 20 years ago?
Okay, well, these numbers come from our supplemental poverty measure, and so what we're looking at is just a snapshot of the year 2015, and we're looking at what their poverty status would have been had we not added Social Security to their income, and after we add Social Security to the income, or had we not subtracted work-related expenses from their income before determining their poverty status. So we can see that there would have been 26.6 million more people in poverty had we not added Social Security to their income, and 11.2 million less people in poverty had we not subtracted out medical out-of-pocket expenses. Unfortunately, we only have data on these items going back to 2009, because it was in 2010 that we added the questions on work-related expenses and medical expenses to the current population survey. So we can't go back 10, 20 years. I can tell you that between last year and this year, there were no statistically significant differences in the impact of these different elements.
Have you seen a change between 2009, 2010 and last year?
I don't have those numbers in front of me, but we have those reports on our website, so we can look into the tables on the reports, and each year provides what those marginal impacts would be.
Okay, thank you.
Yes, if you just contact our Public Information Office at 301-763-3030, one of our public affairs specialists will assist you with that. And operator.
Great, thanks so much.
You're very welcome. You're very welcome. Operator, do we have another caller?
Yes, sir. Our next question comes from Susan Heavey with Reuters. Your line is open.
Hi, Susan.
Hi, Susan Heavey with Reuters. Thanks for taking my call. Just one more logistical question at the beginning. Can you say who answered the first question about employment and median income, and also the one on income inequality, who that was speaking?
That would have been our Assistant Division Chief, Trudy Renwick.
For both of those?
Correct.
Okay, thank you. And then if I could just ask you to expand a little bit on the income inequality. I mean, you mentioned the Gini index not moving. What is this telling us about that gap with income inequality? Is it still widening? Is it stagnant? How would you characterize what you're seeing?
Well, between last year and this year, it was flat. There were not any, and I talk about the Gini index, but in our report we provide a number of other different indicators of income inequality, and we did not see any statistically significant changes between last year and this year in any of those income inequality metrics.
Great, thank you.
Thanks for that question. And operator, do we have another question?
Yes, our next question comes from Dan Kadlik with Time. Your line is open.
Hi, Dan.
Yeah, hi. Can you offer any insights as to the trends in poverty as it relates to those in retirement? Is it getting better? Is it getting worse? What are the sort of the key factors driving whatever you're seeing there?
Well, this depends on which poverty measure you use, but poverty rates were down for people 65 years and older for both the official poverty measure and for the supplemental poverty measure. You can see when you compare the supplemental poverty measure to the official poverty measure for people 65 years and older that the poverty rates are much higher using the supplemental poverty measure. And that we've looked at a bit, and it's very much driven by that the subtraction of medical out-of-pocket expenses. So when we take into account medical out-of-pocket expenses, we find that the poverty rates for those 65 and older are very similar to those for 18 to 64-year-olds. Without taking that, with the official measure where we don't take that into effect, then we have lower poverty rates for those 65 and over.
I'm sorry, I didn't quite understand that. So the out-of-pocket medical is driving more poverty in retirement or less?
More poverty in retirement, relative to the official measure where we don't take that into account.
Thank you.
But year to year, from last year to this year, for both measures, the poverty rates for those 65 and older went down.
Did that rate decline at the rate of the nation overall, or is it similar?
Very similar.
Thank you.
You're very welcome. Thank you for that call and question. Operator, do we have another caller?
Yes, sir. Our next question comes from Julie Robner with Kaiser Health News. Your line is open.
Hi, Julie.
Hi, thank you. Hi, thanks so much for taking my call. I have a question about the health insurance numbers. I noticed that percentage-wise, that the biggest decrease, and this is I'm using the 2013 to 2015, was actually, or the biggest increase in coverage was for people with direct purchase, even bigger than people with Medicaid, which is not immediately intuitive. And when I looked at the numbers, there's a number that seems to be like 52 million for direct purchase. That's way, way more people than are in the individual market. So who are you counting as those people?
Jennifer?
Hi. So good question. The number of people, the types of health insurance that we collect are private and government. And within private are the employer-sponsored health insurance and the direct purchase. Direct purchase can be people going out to an insurance company and purchasing directly through them, or also can be through the exchanges. Direct purchase also can be, sometimes people will answer that question when they have a supplemental insurance. So it can be more than just the comprehensive health insurance, which is what we're looking for.
Aha, okay. Thank you.
You're welcome.
And do we have another caller?
Yes, our next question comes from Paula Toti with Sinclair Broadcasting. Your line is open.
Hello.
Hi, thank you. Hi, Paula Toti, Sinclair. I jumped in late, so I just want to make sure I understand. The poverty rate's down over 5%, but when you add in medical expenses, then it's down only about 1% for all ages.
No, this is Trudy Renwick. The poverty rate is down 1.2 percentage points. The official poverty rate is down 1.2 percentage points. What's up 5.2% is household median income.
I'm sorry. Yes. Okay.
Okay.
And when you add in then medical costs, then the poverty rate is just down 1%.
So when we use the supplemental poverty measure, which among other things includes takes into account medical out-of-pocket expenses, there's also just a number of differences between that and the official measure. For that, poverty rate is only down 1 percentage point.
Which tells us that medical insurance is driving more people to poverty long term. I mean, that's really not the case. The impact of medical expenses on poverty are the same this year as they were last year. We have not seen a change in that. Okay, and one more question. Is anything, again, I jumped in late, is there something that jumped out about Ohio in specific that would be important to our viewers?
So most of the numbers that we're putting out, the estimates we put out today are national numbers. We have some regional numbers. But for state and local poverty and income estimates, those will come out on Thursday when we release the American Community Survey.
Great. All right. Thank you.
Thank you for that question. Operator, do we have another caller?
Once again, if you would like to ask a question over the phone lines, please press *1, unmute your phone, and record your name and affiliation when prompted.
And
Our question comes from John Cheeves with the Lexington Herald Leader. Your line is now open.
hi, John.
Good morning. As with a couple of the other older journalists, if you could just identify yourself before you answer. Looking at the uninsured rates, you all had mentioned several differences systemically between the expansion states and the non-expansion state. And I am with the Lexington Herald Leader, a Kentucky paper. We're at the moment an expansion state. Are you all comfortable drawing a causal relationship between the decision to expand Medicaid and the steeper decline in the uninsured population?
So this is Jennifer Day. So we did look at the expansion states, states that expanded their Medicaid eligibility programs, and then the non-expansion states. We have that detailed a little bit more in our report, and David also talked a little bit about that in his presentation. And yes, we do see that expansion states have lower uninsured rates than non-expansion states, and that the change from last year and the change from 2013 is greater in expansion states than non-expansion states.
Okay, and that is, you all are comfortable that's, forgive me for sounding dense, but I am dense. You're comfortable that is due to the state's decision to expand Medicaid to the working poverty population?
We do see that there's a greater change in expansion states overall than non-expansion states in the last 2 years. Yes.
Thank you, ma'am.
Thank you for that question. And operator, do we have another caller?
Yes, sir. Our next question comes from Alan Friedman from Italy's Corriere della Sera newspaper. Your line is open.
Hi, Alan.
Hello. Hi there. Thank you for taking my call. Just this, I wanted to ask about extreme poverty, which I believe is defined still as $2 a day per person in a family. First question, is that correct as a definition? Second, it was in the last report I saw 1.6 million families in America. Could you tell me if that was, what is the number for 2015 of the number of families in extreme poverty?
Okay, we don't publish estimate of the families below $2 a day. What we do have in our report are estimates of the number of people who live with less than half of the poverty threshold. So the poverty threshold for a family of 4 was 24,000. So we have estimates in our report for families of 4 living below $12,000 a year, which is more than $2 a day. But that is down. That is down from 6.6% last year to 6.1% this year. So we have seen.
Just to be clear, just to be clear what you're saying the number of families or individuals?
That's the number of individuals. That's the number of people living in family.
Living on less than half the poverty level
yes.
of $12,000 each.
Yes,
right?
Exactly. $12,000 for a family of 4.
Sorry, just to be clear, I am dense apparently, like my colleague in Kentucky.
Oh, it's complicated.
The definition, it's complicated. The definition of the poverty level is, for a family of four, is what? $24,000 or $12,000 for a family of four?
For the poverty threshold for a family of four, 2 adults and 2 children, in 2015 was $24,036. So when we talk about people who are living below half the poverty threshold, that would be a family of 4 living below $12,000 a year.
And I can do the math on what that amounts to per day myself, but you're saying that dropped from 6.6 to 6.1%.
Yes, yes.
Of the total number of Americans, or of what?
Total Americans, yes.
So roughly 6% of 319 million Americans live in families that are on less than $12,000 per family of 4.
Yes.
Okay, that's and I'm getting last question. 6.6% roughly is going to be whatever 6% of 319 million people is. Is that the number of Americans living at that level?
Yes. If you look in our report, we'll give you the number. About 20 million.
20 million. And do you define that yourselves as extreme poverty, or is that not a term of art you use, extreme poverty?
We don't use the term extreme poverty. We stick to under 50% of the poverty threshold. And we also show estimates for under 125%, under 200%. Some people call that extreme poverty. Some people say near poverty. They're different terms, but we at Census don't have any official definitions of those terms.
Okay, thank you very much.
Thank you for that line of questioning. Operator, do we have another caller?
Yes, our last question comes from Janet Adamy with the Wall Street Journal. Your line is now open.
Hi, thanks for taking my call. Just 2 quick questions on the income numbers. Is there anything that you didn't mention that's a factor in those coming up? I mean, besides the increase in full-time year-round workers. And the second question is on the gender pay gap. You noted there wasn't a statistically significant decrease there, but it is at women at 80%, the lowest level on record. Any factors there that you can point out about why over time that it's drifted down a little bit?
Well, the gender gap is based on full-time year-round workers. So if the improvements in that have been due to improvements in the earnings of full-time year-round women workers relative to men, and I think that's consistent with all of the data on educational attainment and commitment to the labor force that we've seen over that time period.
Think that anything else on any other variables that you didn't mention on the overall income changes?
Well, what I think is interesting with median household income is that it's up really just across the board. It's up in all 4 regions. It's up for almost every age group of household heads. It's up for almost every racial group, except for Asians. So it's really a broad increase in household median income. And it's one of the largest year-to-year increases in median household income that we've ever had.
Sorry, and this is Trudy, right?
This is Trudy, yes.
Thanks.
And before we close, I'd like to remind everyone of a couple upcoming releases. Today at noon Eastern Standard Time, we'll embargo the American Community Survey 1-year statistics. Thursday, September 15th, the public release of the American Community Survey 1-year data will take place. And always, for media who have additional questions or would like to conduct an interview following today's event, please contact the Public Information Office at 301-763-3030 or pio@census.gov. I'd like to thank all of our panelists today for joining us and answering all the questions of the media. And my name is Michael Cook, and I'd like to thank everyone for participating in today's news conference. Thanks, everyone.